There is a golden root that challenges the very foundation of modern medicine. In a landmark clinical trial, it was proven to be as effective as 800 milligrams of ibuprofen for severe arthritis pain, but without the dangerous side effects. It's the subject of over 21,000 published scientific papers, making it one of the most intensely studied natural compounds in history, yet it costs just pennies per dose. For over 4,000 years, Ayurvedic medicine revered this root as a sacred purifier of the body, a cornerstone of healing long before the first pill was ever manufactured. It was used to treat everything from respiratory illness to poisoned food, forming the basis of a medical system aimed at longevity, not just symptom management. Today, that same substance is often dismissed by doctors, framed not as a powerful healing agent, but as a dietary risk that might interfere with their prescriptions. It has been relegated from the pharmacy to the spice rack, mentioned only as a warning instead of as a primary tool for health. The problem isn't that it stopped working. The problem is that it works on too many things at once, and it cannot be patented. Its greatest strength became its greatest liability in a system that only rewards what it can control and sell for a recurring profit. Before we open this file and expose exactly how this happened, if this kind of knowledge is important to you, the best way to protect it is simple. Subscribe to this channel and help ensure this information remains accessible to everyone who needs it. The golden root is called turmeric, and its incredible power comes from its active compound, curcumin. The story of how this substance moved from the heart of ancient medicine to the back of a modern spice rack is not a story of progress. It was a calculated demotion. This root, the subject of over 21,000 published scientific papers, wasn't simply forgotten by accident. It was deliberately sidelined. Its removal from the mainstream pharmacopoeia happened not because it stopped working, but because it worked on too many things at once for far too little cost. The fundamental problem, the original sin of this golden root, is devastatingly simple. It cannot be patented. Nature's design cannot be owned by a corporation, and a substance that anyone can grow in their backyard poses a direct threat to a multi-billion-dollar industry built on exclusive synthetic molecules. It doesn't target one single symptom with one single mechanism. It addresses the underlying web of inflammation that connects dozens of diseases. In a system designed to sell a specific key for a specific lock, turmeric is a master key, and that makes it commercially worthless to those who sell the locks. This wasn't a hidden conspiracy. It was a business strategy executed in plain sight through decades of systemic neglect. The narrative we've been sold is that natural remedies are unproven, but the truth is they are simply unprofitable to prove. By labeling turmeric as merely alternative or as supplement, the system created a category for things it had no financial incentive to study. It was a quiet re-engineering of knowledge, where the absence of a billion-dollar clinical trial gets presented as an absence of evidence, ensuring you reach for the pill bottle instead of the root. An entire library of medical knowledge, refined over 4,000 years of human trial and error, was effectively sealed and stored in the basement of modern medicine. The question is no longer if it works. The data on that is overwhelming. The real question is, how did a system convince us to forget what virtually every major ancient civilization knew to be true? To find that answer, we have to travel back in time, long before the first pill was ever pressed, to a world where your pharmacy grew from the earth. Our journey doesn't begin in a modern laboratory. It begins in the dust of the Indus Valley Civilization nearly 4,500 years ago. Archaeologists excavating the ancient city of Harappa cracked open clay pots sealed since 2500 BCE, and inside they found microscopic residue, a chemical fingerprint of turmeric, ginger, and garlic. This wasn't just seasoning for a meal. In a world without refrigeration, this golden root's antimicrobial power was a matter of life and death. It was a technology of preservation, a way to keep food safe, a way to keep your family from getting sick, a foundational pillar of survival. From there, the root was elevated from a tool of preservation to an instrument of the divine. In the sacred Vedic texts of India, written around 1200 BCE, it is called Haridra, a name that appears in charms to ward off disease. By 600 BCE, the foundational text of Ayurvedic surgery, the Sushruta Samhita, prescribed a turmeric ointment to counteract the effects of poisoned food. It was revered as a potent anti-inflammatory and a purifier of the blood, a cornerstone of a medical system focused not on managing symptoms, but on achieving true longevity, on rejuvenating the entire body from within. The knowledge didn't stay confined to India. It traveled along the ancient silk and spice routes, becoming a currency of health. By 700 AD, it had reached China, where practitioners of traditional Chinese medicine embraced it for its ability to invigorate the blood, break up stagnation, and relieve pain, especially in the shoulders. They saw what the Ayurvedic sages saw, a substance that could move energy and clear blockages that led to disease. Two distinct cultures, separated by the Himalayas, looked at the same golden root and independently reached the exact same conclusion about its power. This ancient wisdom even reached the founders of Western medicine. In 70 AD, the Greek physician Dioscorides, traveling with the Roman armies, documented a root he called Cyperus indicus in his encyclopedia, De Materia Medica. He described it perfectly, noting it resembled ginger but had a bitter taste and a vibrant yellow color, a description universally accepted by historians as the first Western record of turmeric. It was there, at the very beginning of our own medical lineage, recognized and recorded. It wasn't discovered in the 20th century, it was simply forgotten by it. But this root was never just a medicine, it was woven into the very fabric of society, a symbol of purity, prosperity, and protection. Its brilliant color was used to dye the robes of Hindu monks, a mark of sanctity and renunciation. It is the centerpiece of the haldi ceremony in Indian weddings, where a turmeric paste is applied to the bride and groom to purify and bless them before they begin their new life. This wasn't a substance you took only when you were sick, it was a part of daily life, a constant presence that connected food, medicine, and spiritual ritual into one seamless whole. For thousands of years, there was a global consensus. From the Indus Valley to ancient China, from Ayurvedic sages to Greco-Roman physicians, humanity agreed on the power of this golden root. It wasn't alternative, it wasn't supplemental, it was medicine. The evidence wasn't in a lab, it was in the generations of people who lived longer, healthier lives because of it. So if this knowledge was once so universal, so fundamental to human health across the entire planet, what happened? How did a pillar of ancient medicine become a footnote in a modern spice rack? The pivotal moment arrived when scientists stopped asking if it worked and started asking how. They isolated the primary active compound, a brilliant polyphenol called curcumin, and what they found wasn't a single magic bullet, it was a biological master key. This wasn't superstition, it was sophisticated biochemistry, a molecule that could interface with our bodies on a level that modern drugs struggled to replicate. The evidence is now cataloged in over 21,000 published scientific papers, making curcumin one of the most intensely studied natural compounds in human history. The ancient world knew the result. Modern science was finally revealing the mechanism. The Ayurvedic sages called it a potent anti-inflammatory, and modern science now knows why. Curcumin directly interacts with our body's master inflammation switch, a protein complex called NF-kappa B. By calming this switch, it downregulates the same pro-inflammatory enzymes, like COX-2, that multi-billion-dollar drugs like ibuprofen and Celebrex are designed to block. This isn't a theory, it's been proven in rigorous human trials. A 2009 study on patients with severe knee osteoarthritis found that a daily dose of turmeric extract was just as effective as 800 milligrams of ibuprofen for pain relief, but with one critical difference: it didn't cause the stomach bleeding. The ancient texts also called it a purifier of the blood and a protector of the mind. Today, we understand this through the lens of antioxidant activity. Curcumin not only neutralizes destructive free radicals, it actually boosts our body's own internal antioxidant enzymes like glutathione, providing a deeper, more lasting defense. It can also cross the heavily guarded blood-brain barrier, where studies suggest it increases levels of brain-derived neurotrophic factor, a critical growth hormone for brain cells linked to both depression and Alzheimer's disease. In fact, a 2014 study published in Phytotherapy Research found curcumin was as effective as the drug fluoxetine, Prozac, in managing major depression. For years, however, scientists were stumped by a critical problem, a paradox that threatened to invalidate everything. In laboratory settings, Curcumin was a powerhouse, but when people consumed it, very little was actually absorbed into the bloodstream. The body metabolized and eliminated it almost immediately, a phenomenon known as low bioavailability. For a time, this was the primary argument used to dismiss its power, the one piece of data that suggested it might not work in the real world. Critics claimed that any benefits were just placebo because the active compound could never reach the necessary concentrations inside the body. But the solution was not in a futuristic lab. It was hiding in plain sight, in the same ancient kitchens where the root was first used. A landmark 1998 study published in Planta Medica tested a hypothesis based on traditional preparation methods. They combined curcumin with piperine, the active compound in black pepper, and the results were staggering. The piperine inhibited the metabolic enzymes in the liver and intestinal wall that were breaking the curcumin down, increasing its bioavailability by a verified 2,000%. The ancient cooks weren't just adding pepper for flavor. They were practicing a sophisticated form of synergistic medicine, ensuring the golden root's power was fully unlocked. So now we have a substance revered by thousands of years of human history and validated by thousands of modern scientific studies. We have the ancient observation and the molecular explanation. We know it targets the same inflammatory pathways as blockbuster drugs without the side effects. We know it protects the brain, and we even know the ancient secret to making it fully bioavailable. The evidence is overwhelming and the mechanism is clear. This raises the most important question of all. If we know all of this, why isn't this the first thing every doctor learns in medical school? The answer to that question isn't found in science. It's found on a balance sheet. There was no grand conspiracy, no secret meeting where a decision was made to hide this root from the world. It was something far more mundane and far more powerful. It was the simple, cold logic of a business model. The suppression of this golden root began the moment our system of medicine decided that healing must first be profitable, and nature's design, tragically, offers no return on investment. It was systematically sidelined not because it failed to work, but because it works on too many things at once, and it cannot be patented. Follow the money. The answer is always there. The global market for non-steroidal anti-inflammatory drugs is projected to surpass $25 billion, while the markets for drugs treating depression, diabetes, and heart disease are worth hundreds of billions more. These are entire economic empires built on the sale of synthetic, patent-protected molecules. Now imagine a single, natural compound that demonstrates efficacy across all of these areas, a substance that anyone can grow for pennies. To a system built on selling a specific key for every single lock, a master key like curcumin isn't a miracle, it's a catastrophic business threat. The fundamental problem is devastatingly simple. A pharmaceutical company cannot justify spending the $1 billion required for FDA clinical trials on a substance that has existed for 4,000 years. There is no possibility of securing a 20-year market exclusivity patent, which is the only way to recoup that massive investment. The entire financial architecture of modern drug development is built to reward novel, synthetic molecules that can be owned and controlled, not ancient, natural ones that belong to everyone. The system isn't broken, it's doing exactly what it was designed to do, which is to protect its own revenue streams. This wasn't a sudden event. It was a slow and deliberate re-engineering of knowledge that began over a century ago. The Flexner Report of 1910 standardized American medical education around a model focused exclusively on pharmacology and surgery, systematically defunding and shuttering schools that taught herbalism, nutrition, or any other natural modality. This created an institutional blind spot, a century-long bias where generations of doctors were trained to see the pill bottle as the only legitimate tool, while the pharmacy that grows from the earth was dismissed as unscientific folklore, a relic of a primitive past. The suppression is maintained today through a strategy of systemic neglect and deliberate framing. The lack of funding for large-scale human trials is presented as a lack of evidence, trapping curcumin in a perpetual state of being promising but needs more study. Its complex, multi-target action is viewed as messy by a research model that demands a single molecule hitting a single target. By classifying it as a mere supplement, the system places it outside the realm of serious medicine, ensuring your doctor never learns about it, never recommends it, and may even warn you against it. In its place, we were given the modern medicine cabinet, a collection of inferior replacements. Instead of one root to address the underlying fire of systemic inflammation, we get a pill for every symptom that fire produces. An NSAID for the joint pain, a statin for the cholesterol, metformin for the blood sugar, and an antidepressant for the mood disorders that often follow. This is the "a pill for every ill" model, a brilliant strategy for generating recurring revenue, but a terrible one for creating genuine health. It manages symptoms in isolation while the underlying condition continues to smolder, ensuring you remain a customer for life. So the golden root was never disproven. It was just architecturally incompatible with the system we built. It wasn't defeated by a superior technology, it was sidelined by a superior business plan. The very qualities that made it a perfect medicine for the ancient world, its safety, its accessibility, and its broad spectrum power, made it commercially worthless to the modern one. We were convinced to trade a master key that costs pennies for a collection of expensive, single use keys, each with its own set of dangerous side effects. And the real tragedy is, it all happened in plain sight. The truth about this golden root was never truly lost. It was simply buried under a mountain of profit driven noise. It survived not in pharmaceutical databases, but in the kitchens of Okinawan grandmothers, in the pages of ancient texts, and in the daily rituals of cultures who never forgot what real health felt like. By understanding this story, you are not just learning a fact, you are reclaiming a birthright. Every person who shares this knowledge builds a wall against a system that profits from our ignorance. If this mission matters to you, help us protect it, subscribe, and ensure this truth can never be buried again. This isn't about choosing between ancient wisdom and modern medicine. It's about demanding both. It's about understanding that the foundation of health doesn't always come in a pill bottle with a childproof cap. Sometimes it comes from the earth, wrapped in nothing but its own skin. The journey to reclaim this power doesn't begin in a pharmacy. It begins in your kitchen with a single teaspoon. And if you remember nothing else, remember this. The world's oldest pharmacy doesn't have shelves, it has roots.